What is a positive surgical margin in breast cancer? Imagine having surgery to remove a tumor in your breast and then learning that some cancer cells might still be there. That's what a positive surgical margin means. It happens when, after the tissue is examined under a microscope, cancer cells are found right at or very close to the edge of the tissue that was removed. This suggests that not all the cancer was taken out during surgery. When surgeons remove a tumor, they try to take out the cancer along with some healthy tissue around it. This healthy tissue is called the surgical margin. The goal is to make sure no cancer cells are left behind. After surgery, a pathologist looks at the tissue under a microscope to see if cancer cells are touching the edge. If they are, the margin is called positive or involved. This indicates that some cancer might still be in the breast, which can increase the chance of the cancer coming back in the same area. If no cancer cells are found at the edges of the tissue, that's called a negative or clear margin. This is the best outcome because it means all the visible cancer was likely removed. Sometimes, the cancer cells are close to the edge but not touching it. These are called close margins. Close margins might still carry a higher risk of recurrence than clear margins, but less than positive margins. The exact size that defines a clear margin can vary. For invasive breast cancer, the standard is often no ink on tumor, meaning the cancer does not touch the inked edge of the tissue. For ductal carcinoma in situ, a type of non-invasive cancer, a margin of about 2 millimeters of healthy tissue is usually recommended. If a positive margin is found, doctors often suggest additional surgery. This might involve removing more tissue in a procedure called re-excision to try to get clear margins. Sometimes, if it's difficult to remove all the cancer with more surgery, a mastectomy might be recommended. The main reason for aiming for negative margins is to lower the chance of the cancer returning in the breast. In summary, a positive surgical margin means cancer cells are present at the edge of the tissue removed during surgery. This suggests some cancer may still be in the breast, and further treatment, often additional surgery, is usually needed to reduce the risk of recurrence. Always remember, each case is unique, and your healthcare team can provide guidance tailored to your situation. If you have concerns or questions about your margins or treatment options, it's important to discuss them with your doctor.